So, we are talking about how to manage medication in the ASC. And medication is, of course, managed by the facility with the oversight of the consultant pharmacist. However, the state statutes govern those processes and CMS or the federal government. So there are two sets of rules we have to look out for. And as a side note, the governing bodies, so for example, AAA, AHC, that certify or accredit these facilities, or the Joint Commission, they have taken the rules of the state and the government together, and that's how they do their audit when they come to accredit these facilities. So I'm going to go ahead and add accreditation bodies. So to tell you a little bit more about the state statutes, let's go. I feel the best way to do that is to show you what the Department of Health in the state of Florida looks for when they come to do a pharmacy inspection. And this will pretty much narrow down the processes that you need to follow in the surgery center. So, for example, in Florida, a surgery center must have a license, and what they have is a modified 2, and usually it's a B, institutional pharmacy permit. And this inspection form, this literally is the inspection form that they use. So this was very helpful to me when I started working with Surgery Center, because I know exactly what they were looking for, and I was able to have all those documentation ready for whenever they come in. So every surgery center must have a pharmacy permit, and it must be valid in Florida. The pharmacy permit is good for 2 years. It must have a supervision of a consultant pharmacist. So the consultant pharmacist must have a consultant pharmacist license. And then again, I'm going to stress that in a lot of states, they do not need a separate consultant license. So, for example, in Pennsylvania, you can act in the role as a consultant pharmacist, but you don't necessarily have to have a license to be a consultant pharmacist. It's one general license that covers that. Um, the facility must have a current DEA registration. The pharmacy must have a policy and procedure manuals, which will be available for inspection. And you must also have, when you go to the facility, to show that you have been there. So what I have is in the pharmacy book, I have a sign-in sheet and the activities that I did on that day. In addition, I have my pharmacy checklist that I go through, and I will show you copies of those. And all medication, of course, have to be properly labeled. So that's part of what they do for their general inspection. And then basically, and these are all the rules and statutes if you want to go and look them up. But the Pharmacy Services Committee are required to meet at least once a year. They must be an emergency box and with a separate log for record keeping. CQI, you must have meetings, which is your quality. So you must show you're doing that on a quarterly basis. Records of consultation, of course, for 4 years. If you compound, which in surgery centers you don't, so this would not apply. And of course, you do not want to have any expired medications on your anyway in the facility. And that is something that I engage the staff with, and of course, I check myself. So in the surgery center, like I said, in Florida, we do not have a type A, but we have a type B. So this section here would apply to surgery center. So they would have to have a utilization of a perpetual inventory system for controlled substances and all medication that are controlled. The drug stock in the establishment must be employed by treatment for the condition that they're treating, and controlled substances inventory must be taken every other year biannually. And of course, the DEA forms or the records of CSOS must be archived and readily retrievable. And controlled substance records must be maintained for 4 years. And basically, that's what the inspector looks for. And those are the requirements. Again, your state might have other requirements, but it's up to you to get that information and see how it applies. This is just an example of the requirements in Florida and how the inspection is actually done. Then quickly, I want to take you over to CMS, which is the federal government. And these are the standards. You can look it up here. This is what they use in the inspection. It's called Condition for Coverage Pharmaceutical Services, and there's a list of 70 or maybe 88, 81 items here. This list may or may not be complete, so I will say to you to go and check this out from CMS website to make sure. This would be if the facility is cited for any type of pharmaceutical issue, this is the tag that they would use. But this is what you would need to follow under the requirements of CMS. So this doesn't matter where your surgery center is located. These are the rules for CMS, and these rules are generally followed by the accreditation bodies. So I hope that this was helpful. And again, this is what the state will be looking for. And as pharmacists, we can read through that. And of course, I have the checklist that will help you to make sure you're following all those rules.